Dear audience, welcome to my 15-month progress report. My name is Melinda Antal, and in my thesis I would like to discuss the optical and mechanical properties of dental ceramics. Allow me to introduce myself quickly. I'm a dentist and a PhD student at Semmelweis University, Department of Prosthodontics. My vision is to provide patients the best all-ceramic restoration, and my mission in this would be to supply dentists a guidance about the appliance of different dental ceramics. I have two specific goals for now, which are strongly connected to each other since both of them investigate a dental ceramic called zirconium dioxide, or shortly zirconia. In my first project, I would like to compare the mechanical properties of additively versus subtractively manufactured dental ceramics with the method of a systematic review and meta-analysis. Over the past 35 years, CAD/CAM has become an increasingly useful technology in dentistry. It basically allows you to produce all ceramic restorations even in your own dental office. When talking about this method, the manufacturing is milling. Milling or subtractive manufacturing is widely available, however it has big flaws like wasting a lot of raw material that cannot yet be recycled and causing the wear of the milling tools, so overall it could be really expensive. Recently, a new method, printing or additive manufacturing, has emerged in literature. As you may know, printing is the method of building objects layer upon layer. There are many available techniques, but the two most popular ones are stereolithography and direct light processing, both based on the concept of photopolymerization. Printing has big potential because it could overcome the disadvantages of milling, like hardly wasting any material and creating multiple objects at the same time with the finest details. But whenever a new material is produced, mechanical properties are the most important to consider. When we want to see if printed materials could overcome milled materials, we have to be sure that they are at least as strong as milled materials, and the most important to evaluate would be flexural strength, since it helps to predict the performance of a restoration. This is why my aim would be to compare the mechanical properties of additively versus subtractively manufactured dental ceramics. This leads me to my clinical question. Do mechanical properties of dental ceramics differ when produced with additive versus subtractive CAD/CAM manufacturing? My population is dental zirconia. I would like to compare additive to subtractive manufacturing, and my outcomes would be flexural strength, vigorous microhardness, and dye ball characteristics. I hypothesize that additively and subtractively manufactured dental ceramics have similar mechanical properties. My implication would be really simple: to provide patients better and cheaper restorations. Here you can see the details of my systematic search that I conducted in 4 databases, and after the selection process I ended up with 196 included articles. On the upcoming slides, I would like to present our results for 3-point bending strength. So 3-point bending strength is flexural strength measured with 3-point bending test. As I mentioned, flexural strength is really important for dentists since it helps to predict the performance of restoration. The unit is megapascals, and for dental zirconia, it is usually above 800. Here you can see my main figures that I would like to show you on the upcoming slides. And here you can see the results for our 2-armed studies. Here we included 9 in vitro articles that had similar weight on the outcome. You can't unsee the big heterogeneity, which is due to the fact that these articles use different brands of zirconia, different specimen dimensions, and different printing techniques, as you can see in the comment section. Our outcome is mean difference, and if the article is on your right, then the milled material was stronger in the study, and if it's on your left, then the printed was stronger. We have an overall mean difference of 182 megapascals, and although we believe this is clinically relevant, it hasn't reached mathematical significance, suggesting that printed zirconia is as strong as milled zirconia. And although printed materials have come a long way and are really close to milled materials, we believe that there's still room for improvement and they can't be applied in the same indications yet. We included many one-arm studies among the two-arms ones as well. Here our outcome is pooled means. We did separate analysis on 3 mole percent yttria stabilized zirconia and 5 mole percent yttria stabilized zirconia, and we conducted subgroup analysis based on the manufacturing methods, so printing or milling. Dental zirconia has usually 3 to 5 mole percent yttria in it, and to put it simple, the more the yttria, the better the aesthetics, but the weaker the material. Here you can see the studies investing 3 mole percent yttria stabilized zirconia. So with milling, we can get an overall flexural strength of 1029 megapascals, and with printing, it is only 702 megapascals. Looking at 5 yttria stabilized zirconia, we can see that with milling we can get an overall flexural strength of 433 megapascals, and with printing it is almost 700 megapascals. So looking at the results, we can see that milled zirconia presents the recently mentioned pattern, which is already well known in literature. So increasing the yttria content decreases flexural strength. But looking at printed zirconia, we can only spot a slight difference. So we could say that yttria content does not that much influence flexural strength, and that with 5% yttria stabilized printed zirconia, we could get really good aesthetical results without compromising for lower flexural strength. So when using milling, when using 3 mole percent yttria stabilized zirconia, milled zirconia could give us really strong restorations, but when using 5 mole percent yttria stabilized zirconia, we could opt for the printed version as well, opening up our horizons to printed materials. Our included studies have the strength of measuring in a standardized way, and we included many one-arm studies among the two-arms one as well, and we are exploring all flexural strength test methods, so 4-point bending test, 3-point bending test, and biaxial flexural strength as well, and we are investigating variable analysis also. But as I mentioned, these studies are sometimes using different brands of zirconia, different specimen dimensions, and different manufacturing, so printing techniques as well. Preliminarily, we can conclude that printed zirconia did not overcome milled zirconia yet, so they cannot be used in the same indications. Printed zirconia is safer for temporary use, but we could consider 5 mole percent yttria stabilized printed zirconia for definitive restorations in the anterior region as well. Our implications for research would be further investigation on 5 mole percent yttria stabilized printed zirconia, and also there's a need for standardizations in the process of printed zirconia, so we should control zirconia content, printing orientation, and sintering temperature as well. Here you can see the status of my manuscript and the progress of my first project, and allow me to move on to my second topic, which investigates the effect of material aging on the color stability of dental ceramics. As I mentioned, the introduction of improved materials and fabrication technique changed the aesthetic restorative treatment patterns and resulted in a higher demand for aesthetics in dentistry. This led to the worldwide spreading of all ceramic restorations which can successfully mimic dental structures. Dental zirconia is one amongst the most popular dental ceramics since it has excellent mechanical properties, and with the introduction of more translucent versions, it could be applied in the anterior region as well. But whenever we place dental zirconia into the harsh environment of the oral cavity, it ages just like every other material, and aging can affect color. And since patients care mostly about appearance, color stability is a crucial factor throughout the functional lifetime of a restoration. This is why my aim is to investigate the color stability of dental zirconia. This leads me to my clinical question. Does aging of dental zirconia affect its color stability in vitro? My population is dental zirconia again. I would like to compare thermocycling, mechanical and chemical aging and compare it to the material before aging, and my outcome would be color difference. I hypothesize that the aging of dental zirconia does not affect its color stability in vitro. My implication would be really simple again, to provide patients long-term aesthetical restorations. Here you can see the progress of my second project. We are still working on feasibility. And here you can see a summary of my 2 ongoing projects investigating the mechanical and optical properties of dental zirconia. And allow me to appreciate your attention and close my presentation with my favorite quote from Oprah: "Failure is a great teacher, and if you are open to it, every mistake has a lesson to offer." Thank you.